I want to do a quick interview with Nicole in regards to her redox experience through pregnancy and birth and post-birth with our amazing daughter, Jo Rose. So, Nikki, do you want to tell us a little bit about how well, first off, what were some of the health challenges you experienced with your pregnancy? And how did you use ASEA's Redox products to help you through that period?
Yeah, so I was taking ASEA Redox before I got pregnant. So, and, you know, I'd had some really amazing results with that. And then when I fell pregnant.
And how did you fall pregnant?
One go at the age of 39. So pretty good. So I think, you know, definitely have heard a lot of great results for people who are having fertility challenges, then starting the Redox and having, you know, that to go away. So really great results there. But I had a very challenging pregnancy. So even when I very first got pregnant, I did not feel great, right? Like I just didn't feel really good. And I was really concerned because I couldn't eat very much. Like I normally eat a lot of salads and a lot of vegetables. And I basically went to like the most bland diet I have ever eaten in my life. So I was kind of concerned about that, but I knew I was drinking ASEA and that was going to be great. And then I took some, you know, supplements and things because I could kind of get them down. And I knew that the ASEA would make those work better. So I felt really comfortable and confident that I was doing the best I can, even though I was having a lot of challenges with how I was feeling. And then I also started to use the Renew like all over from very early in my pregnancy, which meant I didn't get any stretch marks. And my bosoms went from a 12C to a 12GG. So they should have had stretch marks on them because it was a very big increase, but I didn't get any of that. So that was really great.
And what about other parts of your body that you use the Renew on to increase elasticity, for example?
Yeah, well, I use it all over my stomach as well. I didn't get any stretch marks on the skin on my stomach. And I just used it all over really in my pregnancy. So that was really good.
And we know that using Renew twice a day for 28 days increases elasticity by 20%. Yeah. So very, very good for those parts of the body that need to stretch a lot during delivery and as being pregnant and getting bigger.
So yeah, before, like, you know, in the lead up, a few weeks before the baby is due to come out, then you can use it internally as well. And but anyway, I didn't end up having to have a need for that in the end, but that's okay.
Yeah. So great. So we went into the last few months in particular were quite difficult. You experiencing eclampsia. You did have a history of 25 years with a fatigue issue and numerous infections that were undiagnosed and laying dormant in the liver for many years, for a couple of decades. And that probably caused some challenges with the liver, which probably caused some problems, and you experienced eclampsia in the preeclampsia, in the build up to the birth. Yeah. And it ended up with some pretty heavy swelling and spiking of blood pressure and liver failure. And so baby came 3 days early. Yeah. And although we had a natural birth plan, and we actually had the first private midwife for Caboolture Hospital. And that's one of the things in the research is ongoing midwifery with the same midwife throughout a pregnancy and post-birth has one of the most significant results for positive outcome of birth. And so we were lucky enough to do that, and the first couple to do that in the Caboolture Hospital. We went in with a completely natural birth plan, but due to the extreme preeclampsia, we went in for a blood test, because the blood pressure was spiking, and we didn't leave the hospital. So we weren't exactly prepared. We didn't think we were going to be staying, right?
No. So I think just talking about that a little bit. So I had like really significant swelling probably from 6-7 months, like significant. So I didn't get that big until later in my pregnancy. I could actually wear my like regular jeans until I was like probably 6-7 months pregnant. But then I got really, really severe edema. And so it was to give you an idea of what it was like. And I think the ASEA really helped me get to term because it was so severe. If we would look, we've got little tiny dogs. They weigh like between 4 and 7 kilos. So they're really small. And we would like take them out. I would sit down in the park while Justin would take the dogs for a walk, and they would come back and see me and they'd be really excited, and they would stand on my feet, and it would leave a paw print in my foot that my edema was so bad that would like not immediately go away when their paw was removed. And they're not heavy, right? They're like light little dogs, and it would probably take, 5 seconds for that, maybe longer, maybe even 10 seconds for that paw print for you not to be able to see it anymore. So the edema was really severe. There's no photos of me like in the last few weeks because I looked very swollen in the face.
Because you didn't want any photos taken.
I actually looked like I had anaphylaxis when I would wake up in the morning. It was pretty bad. Yeah. And I believe if I hadn't been drinking ASEA, that they would have put me in for an emergency C-section many weeks, if not like a couple of months before Joy was born. I think that like actually kept, because my blood pressure didn't go up until right at the end. Like like we managed to keep it down even though my edema was so bad, like right until the end of the pregnancy. And I drank extra ASEA. I was doing like probably a double dose, probably like 240 mils a day through the last part of the pregnancy. So I really believe that is what helped me get to term, and maybe even, stopped me having a worse situation after.
So that actually brings up a really great thing that a lot of health products on the back of the label says, if you're pregnant, consult a physician, right? And I do believe that the ASEA used to say that. It doesn't say it anymore.
It's a food, okay. That's why.
That's right, because it's a food these days, so it doesn't have even any health claims in Australia. Mm-hmm. But say, for example, someone was in a different country, like overseas in America, and they saw a warning on the back of the bottle saying, "Hey, if you're pregnant, please consult a physician before using this product." How would you respond with why you feel that ASEA is safe to have when you are at a very delicate time and having a baby?
Well, we know from the gene study that ASEA has done that it's a 20 to 31% positive increase, positive influence on your genetic expression. So when you're growing a baby, is there any time that you would want like a positive influence on genetic expression for that baby? So I think it's like something that's essential that people should take while they're pregnant for giving the baby while it's growing the best chance, and before you get pregnant, of being formed in a healthy way. And it's been really interesting to see. So I had a lot of health issues as a child. I was hospitalized 2 to 3 nights a week. So I was 5. Justin had multiple surgeries before he was 3. And Joy, the worst thing that she gets is like a runny nose and a cough, which she's had like twice. And it doesn't even bother her. Like she's still like parties all day. Like she doesn't even like stay home from like daycare. She had a bit of a cough in Hawaii, and she just like kept charging on till like 11 o'clock every night. So it's really interesting. And I believe that is the influence of ASEA in utero, because she doesn't really drink much now. She doesn't drink very much.
Well, only on the days that she feels like she wants it. She's got access to it at any time, and some days she'll have half a pouch, and many days she won't even touch it, but she can self-regulate.
Yeah, but she doesn't. She's
okay,
not drinking
so
it
we've
all
got
the time.
a lot to get through. So the other thing was what I was really getting at there was a safety study. So ASEA spent millions of dollars on safety studies and found that it is absolutely zero non-toxic. It's actually less toxic than water. Okay, so now let's go back to the delivery. So we go into hospital and blood pressure spiking. They do some blood tests. They're like freaking out about your liver. And they're like, wow, you already got to stay here and let's try and have a baby. So unfortunately, we weren't able to go into natural contractions. So they had induced contractions. And what was that like? Like, what did we do to prepare the birth room?
To prepare the birth room?
Yeah, the birthing suite. Like we did birthing hypnosis before.
Yeah.
So we did some hypnosis lessons. So you did a lot of breathing.
Mm-hmm. I did a lot of breathing. I had really relaxing music and headphones and like an oil burner. I had like everything to just try and like really stay calm in the birthing suite. And I had everything written down of what I wanted to do. I had Renew in there to be like, put on my back and things like that. So being prepared, like, really, really helped, definitely, to be calm in a very, like, what could have been a extremely stressful situation.
I think the headphones is really good to mention, because controlling sensory input in a stressful situation is really important. So you're able to just put the headphones on and kind of block out the drama of what the doctors and nurses and what I and the midwife was dealing with. Mm-hmm. And also the fact that you had advocates there. So at all times you had an advocate for you. Mm-hmm. And you went into that situation with a written birth plan, because we were only expecting to do a test and leave the hospital. We didn't actually have everything with us, but we ended up writing down exactly what we wanted to do and getting you to sign that and letting everyone know that I was in charge of decisions if you're incapable of doing that. And then if I wasn't able to, that our midwife would represent us as well.
Mm-hmm.
Yeah.
Yeah, totally. So yeah, that really helped, being prepared and being organized. And of course, I had all my Redox and my supplements and all my stuff in my bag.
Yep.
As well.
Okay, cool. So things start to go downhill in that you were in labour for 16 hours. And unfortunately, that didn't go particularly according to plan, because you just didn't, cervix didn't dilate enough, and the blood pressure continued to skyrocket. So at that point, it got a bit dangerous. And at one point, I think Joy's heart rate started to increase, and they were concerned about her. So we did decide to... That night we didn't go into induced labour. We induced in the morning.
Yeah. And that's when Joy's heart rate had issues, when it was in the induced labour. So
yeah.
And then, we ended up having to have an emergency C-section.
No, we did not have an emergency C-section. We had a C-section.
That's what's on the paperwork, darling. It says emergency.
Yeah, no, because a true emergency C-section, no, we did not have an emergency C-section. You were not rushed in for a C-section. You were in labour for 16 hours, and we had an elective not an elective, but we were forced to have a C-section, but it was not an emergency C-section. That's quite a different thing. I was able to be in the surgery room with you, and that doesn't happen in an emergency C-section. And when that happened, we were able to have the baby put directly on the breast. And
in the skin.
Sorry?
Delayed cord clamping, cord milking.
Delayed cord clamping. We're the first people to do that in Caboolture Hospital, and that has to do with the stem cells that's in the umbilical cord, which is
vaginal
super
seeding.
Powerful. And vaginal seeding, which has got to do with the bacteria. Sorry, you're talking over top of me, and I'm not getting what you're saying.
Which you can look up. People can look that up if they want to know more about that.
Yeah, well, what's the movie? Is it?
It's called Microbirth, the movie.
Microbirthing. So that has to do with the bacteria that the baby gets. So because if the baby doesn't go through the vaginal canal, the birthing canal, it doesn't get those bacteria literally squeezed into its skin. Mm-hmm. And so you can do that by using a swab in the birth canal, and then putting that all over the breast and in the mouth of the baby in order for the baby to get as much of that probiotic and bacterial seeding for the biome. But let's talk a little bit more about vitamin D and stem cells in the umbilical cord. So you've done research of like 40 or 60 pages of report on vitamin D that you had, and we discovered that vitamin D, all the vitamin D in Australia had some sort of...
vitamin K.
Sorry, vitamin K. That's correct. Vitamin K had some sort of chemical or preservative in it. Uh-huh. We could not get a pure vitamin K in Australia. And so we actually ordered some from the States where you could get oral drops of vitamin K if you needed it in the case of a very traumatic birth. But Joy's wasn't a traumatic birth, in the fact that her head wasn't squashed with clamps or anything like that. Mm-hmm. And so we elected not to have vitamin K because it can affect the liver, and a baby's liver is not actually designed to take a massive hit of vitamin K. But what they are designed to do is receive all the stem cells out of the umbilical cord. And if there is a bleed, then that's what the stem cells do. They actually go to work and repair that.
And there is a really nasty preservative in the vitamin K, whether you have the oral drops or the injection. And I was not willing to have that. So, yeah, and it was really interesting. And this is why, you have to be an advocate for yourself when you're pregnant and for your children. and not just hand over to the medical system and things like that. You have to do your research, and they really came and pressured me to give Joy vitamin K the next day after she was born, and they left me with paperwork where this why I should give her vitamin K, and the second paragraph was that a known side effect of the vitamin K injection had been seizures or death, and that was what they gave me to convince me to give it to her. And I was like, that's just very strange.
So the moral of the story for that is to read the fine print when all drugs and invasive procedures are concerned. Yeah.
Yeah, and she didn't need it. Like she wouldn't have even been in the hospital still if I hadn't had to be. I had to be in the hospital because I was still having massive challenges. But if I hadn't been having those, Joy and I would have been we would have been home, because there was no reason for her to still be in hospital like longer than like 6 hours is normally what they keep you at the hospital if there's nothing wrong with the mum or the baby.
Yeah. Okay, so so baby got to get onto the skin straight away, onto mum's breast and skin straight away, and then she was given to me because mum was getting sewn up and mum had an epidural and was a bit out of it.
And they were worried because they were worried about my kidney function too, so I had to go into observation. So because they were like worried about my results and things that were going on, so that they wouldn't allow me to leave. Like that, I was just in the recovery area next to the operating theatre. They wouldn't actually allow me to go back to the wards.
Right. So I'll talk about this bit because you're out of it.
Yeah.
You're on drugs, man.
It was like totally drugged out.
And so at that point, when Baby Joy was given to me, I was amazed and will forever be struck by the iridescent, almost alien-coloured eyes that were just beaming out of me. Like her life, the spirit in those eyes was just amazing. And she had an egg on her head. So her head was quite elongated in an oval shape because she had been rammed into the pelvis for 16 hours but didn't get through. And she had, on the side of her head, she had about half the size of an egg. And so I'm in my like surgical scrubs with a tube of Renew 28 in my pocket. And the very first thing that I did, as soon as I felt her and I felt the egg, I started rubbing Renew 28 on the back of her head. And that egg, I continued to do that like literally every few minutes. And that friggin' like huge swelling had disappeared within 30 minutes. Within half an hour, it was gone. Completely gone. And that was, to me, that was pretty mind-blowing. And that's where then Bubby and I and the nurses and the midwives did all the checks and made sure she had 5 fingers and 5 toes and 10 fingers and 10 toes and all that sort of stuff. And that
hopefully
was
not 5.
Really good. 5 per digit, per limb. Yeah. And, okay. And so then, right. So back in the wards then, when you're recovering, because your kidney and liver function actually decreased post-birth. And this is really interesting because preeclampsia is supposed to be caused by a poor placenta attachment. So the mum's body tries to compensate by upping the blood pressure, and it's supposed to go away once birth happens, but yours got worse. So that was an interesting case of Western medicine not actually knowing the cause of your condition.
It actually got a lot worse. So, immediately when we got into recovery, Jocelyn put Renew 28 all around where I had the bandage from the C-section. So we just put it all around there, and I had some ASEA, but my blood pressure continued to get like a lot worse, like very significantly worse. They had to keep increasing the drugs that I was on for quite a few days. I actually gained weight. I gained 10 kilos in the 5 days that I was in hospital after I'd given birth, because I just kept swelling from the poor kidney function. So that was an interesting thing. And my mum had to like go and find some more clothes for me to wear and buy me underwear because I could like not fit into the stuff that I'd worn during my pregnancy.
Why did you put on 12 kilos or something in a few days?
10 kilos while I was in hospital, and then I lost 12 kilos in 8 days once I got home. I knew that I would get better once I got home, once I got out of hospital, but they wouldn't let me out of hospital because my blood pressure was so unstable. So I continued to drink ASEA, a lot of ASEA. I just can't even imagine how much worse I would have been without that.
And I think you're on like a bottle a day at that point.
Yeah, I just had it. I didn't tell them what it was. Like that was the other thing, because you know they don't want you to take anything in hospital besides their drugs. So I just didn't tell them what it was. I had a Cia, I had vitamin C bought up for me that was in my, you know, I just had it in my bag, and I just took it when the nurses
You
were
had a
like,
bunch of nutritional supplements.
yeah, I had a bunch of stuff in there, and I wouldn't take their nutrition. Like they wanted to give me iron, they wanted to give me magnesium, which was terrible. So I
Which
just
is
did
all
like
synthetic stuff.
um,
What the allopathic industry provides with those kind of supplements is non-organic,
yeah,
synthetic, not bioavailable, not biocompatible.
yeah. And yeah, I did take all of the drugs though, because I really did need to take all of the drugs at that point. So I took all of the drugs they had, and but then once I got home and I was taking a third of a bottle of Acia a day when I got out of hospital. So I was in hospital for like 5 days after Joy was born, and then I was taking vitamin C, and I was also taking liposomal glutathione when I got home, and I was able to really get things under control really, really fast. When I got home, I lost 12 kilos in 8 days, which was all of the fluid that I'd gained from my kidneys not working very well. I like would do the slowest walk you've ever seen around the block. It was really, really slow. And yeah, just really started to get moving, and used a lot of ACA, used a lot of Renew, rested as much as what I could.
Still didn't get any stretch marks, even though you blew up like a balloon in the last
No,
week.
I didn't, which was amazing, because I was so massive. Like when I got out of hospital, I couldn't even like wear my maternity clothes that I wore in, like that I had in the hospital home. My mum had to like go get me other stuff to wear home because I couldn't get them.
Yeah. The other thing was the quality of food that you had. So we had an esky in the room, like every meal you had like either prepared or it was bought outside the hospital so that you ate real food.
Mm-hmm.
And also for Joy. Now, because of the induced labor and because of the drugs you're on, your breast milk didn't come straight away and colostrum didn't come straight away.
Yeah.
And we did have an incident with at one point the nurses, when I wasn't there, convinced the situation to have cow dairy formula,
Mm-hmm.
and Joy screamed
For
for
about 10 hours.
yeah, it wasn't good. And then I think other than that, we used goat milk a few times, but it was only a couple of times or something, wasn't it?
It was quite a few times when we were in hospital that we topped up with the goat milk formula. So I just went and my dad just went and bought some goat milk formula and brought it up to the hospital. So yeah, there's a lot of things that you can do, and you can see, and the nurses were like, no, she's not screaming from like the cow milk formula. So she was like 2 days old and she'd not screamed, and she was screaming like she was in pain, like I've heard her do that scream once since when we gave her first homeopathic. And that's the only other time that I've heard her scream like that, like never ever since. And I was like, it is. And they were like, no, it's not. And I was like, you're not to give her any more. And I just was like, she can have whatever I've expressed tonight, and she's not having any other food. And they're like, but it's not enough. And I'm like, I don't care. You have to wait until tomorrow to like give her any more top up.
And the other thing is they kept pricking up the blood sugar level, right?
Mm-hmm.
And that would upset her. And you were like, is there any risk of diabetes? Is there any evidence that she has diabetes? No. Stop bleeding her.
I did, yeah, and now I'm like, why are you doing it? So this is like an example of like you do have the right to ask questions about what people are doing. I'm like, why are you doing that? So they would come around and they would like do the sugar test. And I'm like, why are you keeping on doing that? Is there any abnormalities? Because this is like, she's 2 days old. And they're like, no, it's just standard procedure because she's in hospital. And I'm like, but she wouldn't be here if I wasn't here, right? And they're like, no. And I'm like, stop doing it. Just leave her alone. Like, she doesn't need it. Like, we're here because I am sick. Deal with me. Leave her alone. And they did, but they weren't happy about it.
But it took some advocacy to get that.
But I'm mean. I'm tough. I'm like,
yeah. And the other thing was that, you weren't, you and I were not known to be IV drug users or, doing blood transfusions or having sex with wild people. So we chose to delay any initial Hep B injection at birth as well, which they like to do at the time of birth.
Yeah.
So that's a whole interesting conversation around whether that was our choice not to have that invasive immune response with amalgam, with mercury and aluminium and peanut oil and the whole bit in that particular vaccination at birth, like in those circumstances. So
that one they didn't really make any comments on, I found, because I think, you know, Hep B at birth, maybe people are like, yeah, well, they didn't like actually come and.
They didn't harass us about that.
Any suggestion.
Interestingly, they harassed us more about vitamin K days after the event when there was obviously no problem with the child.
Yeah.
Kind of interesting.
Yeah.
Anyway,
so
the other thing was that being really organized and having a plan and having it all written out, and having particularly the midwife there as well, like the medical team was actually extremely respectful because we made an informed decision and obviously had given each other consent.
Yeah, they were really fantastic. They were really, really great. So it was a good experience with them, even though it was it was kind of like one of those births where just about everything went wrong, apart from like a major bleed or something like that. But, you know, most of the stuff went wrong, but it was still like a good experience because we were organized and prepared. So. Yeah.
And you were going to say?
Oh, I can't remember.
So one of the great acronyms I always recommend people to use is if they're in a situation, and unfortunately, generally when you're having a medical trauma, you don't know what to do. It's overwhelming. It's scary as hell. And one of the best things you can do is use your brain. And brain stands for B. What are the benefits of this particular treatment or drug or therapy or procedure? Brain, BR, what are the risks involved with this particular drug, procedure, therapy? A is for alternatives. Are there any alternatives to this situation? What are the indications? I is for indications. Why is this indicated? Why should I be doing this? And N is for what if we do nothing? What if we do nothing? Is it going to get worse? Is it slow? Is it fast? You know, why do I need to do this right now? So yeah, use your brain when you're in these situations and ask lots of questions and have an informed decision to take charge of your health. So then baby came home.
Yeah.
Sorry?
Sorry, you go, and then I'll just wrap up with something.
Yeah, and so then baby came home, and within 6 weeks she was sleeping. We weaned her down. She went straight to her own room. We read a lot of French books, and an American author which wrote a book called Bringing Up Babe, B-E-B-E, Bringing Up Baby, which was kind of looked at French parenting style, and then also Baby Wise. Very good friends of ours gave us. Very grateful they gave us a book called Baby Wise, and that's a whole series of books, and that's a Canadian parenting model, and both those models were very different to the Australian recommendations of parenting, and we followed them and have had extremely different results to many people that have followed the Australian recommendations. And at 6 weeks she was sleeping through most of the night, and we were getting feeds down to, was it every 4 hours at that point?
She was having 5 feeds a day at 6 weeks and 4 at 10 weeks.
Yeah.
So
say?
I was going to wrap up with just saying, you know, that, you know, whether it's like this situation was obviously a pregnancy thing, a big health challenge, and people are like sometimes like, well, why did you have this when you're drinking a Sia? And it's like, well, how much worse would it have been if I'm not drinking a Sia? And the thing is to be patient and to take time for the recovery, or if you're having a big health challenge, give it the time to get the results. Like, so even though I was able to get off all of the medication that I was on within like probably 5 weeks, I think, from Joy being born, and I was on like very, very hefty blood pressure, like super high doses of blood pressure medication, it still took me a really long time to recover from having multiple organ failure. Like, it wasn't like an overnight thing that I recovered from. It took really close to 2 years for my body to come back to where it was, even with doing everything that I know how to do, because it's like a serious thing. To have like your kidneys and your liver fail is like a massive thing for the body. So I would say to anyone, you know, and this was like a pregnancy thing, but you've got like a big health challenge. Maybe you're watching this, you've got a big health challenge. It's going to take time. You know, when Justin had his big health challenge and his Lyme, it's like all the cells in the body take 7 years to completely turn over. It hasn't been 7 years since he's been recovered yet, right? So there's still things rebuilding in the body. So yeah, I just think it's really important to be patient with yourself and, you know, be kind to yourself. And like, yes, things are working, but sometimes it's still going to take time for you to get to, you know, the ultimate level of health that you want to experience.
Yeah. So be committed and be informed to get the best outcome.
All right.
All right.
Quick questions, and then we're just going to go a really quick thing on events.
Okay. So if there's any questions, pop them in the chat box. But we'll wrap up this Redox Talks. And thanks for sharing your story, Nikki, and about the amazing delivery of Joy Rose. And she has been extraordinarily healthy, much healthier than Mum and Dad were at her age.
which is amazing, because like it's the worst I've ever eaten in my entire life when I was pregnant. Like that's like not a joke, like terrible.
Yeah, well, it's funny the things you crave when you're pregnant. All right, so how about we finish recording, please, Nick?
Okay.